Good morning, good afternoon, good evening, wherever you are. This is Bill Maddox from Durham, New Hampshire, from the campus of the University of New Hampshire, Center for Social Innovation and Enterprise. I'm very happy to welcome you to the third in our series of living case study webinars. Today we'll be talking about measuring social sector franchise impact and how lean data measurement can help improve franchise impact and success. We have a really exciting panel today. I'm really excited about this webinar. It's a question that through this living case study process has come up again and again is we know we need to measure impact. We know that measuring impact is critical, but we're not sure exactly how to do it at times. I think the challenge of looking at impact measurement has been tackled by a lot of different organizations, but probably none better than Acumen. So we're very happy that they are part of this webinar today. Let me start by introducing our panelists and giving you a little bit of the kind of rules of the road for the webinar. First of all, our webinar moderator will be Fiona Wilson. Fiona is the Clinical Associate Professor of Social Innovation, Social Enterprise, and Sustainability, and Executive Director of the Center for Social Innovation and Enterprise at the Peter T. Paul College of Business and Economics. Her teaching and research focus on how the power of business can be harnessed to help address some of the world's most pressing social and environmental issues. She focuses on innovative entrepreneurial companies with business models are good for people, the planet, and profits. Fiona provides critical support to the Social Sector Franchise Initiative as Executive Director of CSIE. Next, we have Greg Starbird. Greg is the founder of Starbird Consulting. It's a vehicle through which he and handpicked specialists catalyze others to use innovative business models and technologies to distribute life-enhancing goods and services to broad populations. Starbird Consulting combines analytic rigor and real-world operational experience, deploying flexible tools representing over a decade of experience in multiple countries. Greg is a pioneer and leader in the distribution of healthcare in emerging economies. His deep long-term involvement in multi-unit and franchise healthcare enterprises since 2005. But also serves on the Social Sector Franchise Initiative Advisory Board. And finally, we have Ashley Spire, who is the Lean Data Senior Associate, who's joining us from Nairobi, Kenya, in the offices of Acumen. Prior to joining Acumen in June of 2014, Ashley worked at the Council on Foreign Relations in New York, where she conducted research on Cuba's energy landscape and Brazil's foreign policy strategy in Africa. Her passion for international development and social entrepreneurship began during experiences in East Africa, where she learned the importance of local ownership in development efforts. Let me just give you a little bit of an idea of the format today and how you can participate. We will go through a series of slides that Fiona will kind of lead us through. There's a chat box that you'll see. If you wave your mouse around, you should be able to see a chat box pop up. And it's there where you can ask questions. We'll accumulate those questions throughout the webinar, and then near the end of the webinar, the last 15 minutes or so, you'll definitely have an opportunity to ask questions and follow-up questions of our panelists. So please participate by using the chat function. All right, I'm very happy to introduce Fiona Wilson and have Fiona take it from here.
Thank you very much, Bill. Good morning, everyone, or good afternoon, good evening, wherever you are. As Bill mentioned in his introduction, I have the privilege of being the Executive Director for UNH's Center for Social Innovation and Enterprise. We are a joint initiative between our business school here at UNH, the Peter T. Paul College of Business and Economics, and also our School of Public Policy, the Carsey School of Public Policy. One of the reasons that our center exists is to really think about how do we help tackle some of humanity's toughest challenges. So we're intentionally broad, and we help students and community members think about how do we really use the tools of the marketplace, of business and entrepreneurship, but also the levers of public policy to drive positive social and environmental change in the world. One of the biggest questions I think that we think about is how do we do that efficiently and effectively, and how do we do it at scale? I've been involved in this world of social entrepreneurship for about 15 years now, and I think this question of how do we take promising models and then find effective ways to scale them so that their impact can be enjoyed by many, not just a few, has been one of the biggest topics of the social entrepreneurship field, both sort of academic and in practice for the last 15 or 20 years. So when I first learned about the idea of using a very successful business model, business format franchising, which has been so successful in the United States and around the world over the last number of decades as a way to effectively scale innovations, I became really interested and first learned about an organization called the Health Store Foundation, the Child and Family Wellness Clinics, and the work that they were doing about a decade ago. So when we had the opportunity here at UNH to extend some of our work at the Center for Social Innovation and Enterprise to start looking at social sector franchising, we were really happy to do so. We're very lucky here that we also have the Rosenberg International Franchising Center, which is a center that obviously, as you can tell by the name, really focuses on business franchising. And so it was a really wonderful opportunity for us to come together with our expertise in the social sector to partner with our colleagues at the Rosenberg Center, whose expertise is in commercial franchising, and to start to put together our initiative on social sector franchising. So we've been working on this initiative now for about 3 years. We'll be having our 3rd annual roundtable, which is an invitation-only convening in October. But more broadly than that, the mission of the Social Sector Franchise Initiative here is to really help contribute to this growing field of using franchising to deliver social goods and services by bringing people together. Our roundtable each year brings together leaders who are social sector franchise entrepreneurs, but also commercial franchise experts, as well as people from other NGOs, investors, donors, and people from the public sector. More broadly, we also aim to produce highly applied and relevant research to the field and provide information on the social sector franchising mechanism so that we can really support this growing field. One of the big topics that has come up consistently over the last 2 roundtables that we've done in 2016 and 2015 was this issue of how do we know if social sector franchising is doing what we think it's supposed to do? How can we show that it is allowing the scaling of impact, and how do we even measure impact in the first place? And this is not something that is only relevant to social sector franchising. It's a big topic in the whole field of social innovation and social enterprise. There's been a lot of work being done by many people, academics and practitioners alike, to really understand how do we measure and demonstrate the impact of social entrepreneurship. And so we wanted to spend this webinar talking about that in the context of social sector franchising, because we see it as something that's critical to allow the field to progress, to continue to improve, but also we know that this data is going to be really important if we want to attract more funders, more impact investors into supporting social sector franchise organizations. So I'm going to hand over, with that said, and that introduction, I'm going to hand over to Greg Starbird. Greg is going to give us a little bit of an overview, very briefly, on sort of what is the status of impact measurement in the field. He's going to give us some brief examples of some of the existing tools out there, but also to talk very openly about some of the limitations of those current approaches. So Greg, if I could hand over to you, that would be fantastic.
Yes, thank you, Fiona. Can you hear me okay?
Yes, absolutely.
Okay, great. So if you could go to the first slide, please. Or the next slide. Yep. Thank you. So this first slide of mine depicts a social sector franchise network. Each of these shops is an individual retail unit. So these could be physical locations or salespeople who walk around or whatever. The point is that they are connected You can think of each one of these icons here on this slide as a single franchised clinic or franchised school or franchised water kiosk or whatever, with the brand distributed across all of the units. Next slide. This second slide shows one individual retail unit. So whereas in the first slide you had the network, in the second slide you have just one clinic or one school or one water kiosk. And of course, there are people in the orbit of this retail unit, this little shop. So I'll now show you two different ways of looking at these people surrounding the little shop. Next slide. Could you go to the next? Yep. So the first way of looking at people in the orbit of the little franchise shop is financial, money. Now, if any one of these parties here does not find sufficient monetary value in your franchise network, your network fails in some essential way. This is pretty straightforward, of course. If customers don't know about you or aren't compelled by what you're offering, or for whatever other reason don't buy things from you, your shop and your network don't have enough revenue and you go out of business. And it's the same for others on this slide in their different ways. You need someone to lend startup capital to franchisees. You need investors to invest so you can launch and operate your company, and so on. Next slide, please. So similarly, the second way of looking at people around this little shop is impact. And I think this is different to some degree than a normal franchise network. In other words, a socially minded or social franchise network or social sector franchise network has particular concerns about impact. So some people needed to be satisfied with regards to monetary value, and some of these other people need to be satisfied with regards to impact. And when I say need to, what I mean is, again, if you do not achieve sufficient impact in the eyes of any one of these parties, your enterprise fails in some essential way. So just briefly, how do these different people look at social impact? If you go to the next slide to show the impact, yep. So of course, we're familiar with customers and social investors, and I'll say, or I should say social investors and donors, which I should come back to in a minute or two. But in the meantime, I've also put regulators and franchisees and customers, and I could put employees on here. Franchisees, the franchise network to succeed must have a positive social impact, as judged by franchisees using whatever criteria they have. Think of how demotivating it would be to own a franchised facility or multiple as part of a social sector franchise network that's distributing counterfeit medicine or water that makes people sick, and so on. So this can't happen if you want to succeed. Franchisors, in turn, must take care to attract and retain franchisees and have them enthusiastically spreading the gospel of their brand in more and more locations. Similarly, customers want to know that the impact of the business is positive on their bodies, their families, their communities, and so on. If there were a local dispute between a local community and a franchise shop, foreign grant makers might not cut off funding, but the business would fail if the local community turned against it. And the franchisor uses money and time and effort to communicate to local customers. Turning to regulators, want to know that the medicine or education or water you are distributing is of sufficient quality, fits their regulations, isn't leading to the local hospital or school that's in the government network being understaffed, and so on. And so social sector franchise networks build things into their operation to maintain government compliance, and if the impact is negative in the eyes of the government, it may mean the franchise network goes out of business. But back to the usual suspects, social investors likely want to see some sort of double or triple bottom line of both money and social and or environmental impact. And donors and grantors and subsidizers can want a whole range of things: photos, survey results, results of a randomized control trial, statistics, or whatever. So you can go to the next slide. Thank you. I wanted to just make a general point here briefly that over time, various methods of impact measurement have evolved. And of course, this is obvious in some way, but for example, these days, I'd say a lot of people in the social sector franchising arena, think of photographs and anecdotes as sort of a low-level proof or evidence of impact. But think of imagine seeing a photograph back when cameras were just coming into existence. This would be a very worthy form of conveying impact to some degree. So often when we talk about social impact, we're talking really only about a slice of the social level impact that an enterprise makes. We're talking about satisfying donors or investors or other funders with what they currently consider good evidence of impact. And there's nothing wrong with that. It's just that the type of evidence of impact people want evolves. It's not a static concept, and people at various points in time have conveyed impact in these different ways, which is great. It's why we're here today, to keep making progress on how we perceive and measure impact. Now that most people have mobile phones and social sector franchising exists, and there have been other changes in the world. Next slide. So within the universe of social investors and donors and so on, there are a number of neat ways of measuring impact, and systems have emerged for doing so. Here's a bunch of acronyms that are prominent in this space. Some of them focus on environmental impact versus social impact more broadly. Some of them are really broader goals. There's different categories represented here. I'm not going to go through each one, but I want to make a different point as someone who has been involved launching and operating social sector franchise networks by way of an example. I remember a time when I was involved in a franchise network that reported impact. This was a small organization reporting impact in 3 or 4 different ways with using different acronyms here and others. So for example, we reported via the IRIS indicators to the UK government, and we reported via totally different indicators to a family foundation. Those indicators had to do with the financial performance of the franchisee loan portfolio. And of course, we posted photographs and stories for online donors. We collected experiments internally and described them for grant applications and so on. Now, should we see these ways that we conveyed impact as a savvy way of navigating the landscape of impact-hungry onlookers? Or is there something a little bit off here? Not necessarily with each of these individual impact frameworks. All of this might also be true, but with what it all adds up to realistically for a emerging or a new social sector franchise. This brings us to our next slide. So we just talked about the first bullet here, different audiences. Different audiences demand different evidence of different impacts. Another limitation of current methods, in my experience, is a sense of arbitrariness. So for example, a social sector franchise can say, we created one job. What does this mean? Does it mean someone had a job for one day or a year or sold $100 of goods over a period of time? You can, of course, define such a metric precisely, but the more precise your definition, the fewer businesses can be compared with this same metric. Similarly, or in a related way with accountability, some of these impact measuring methods are much more rigorous than others. The IRIS and so on are very thoughtful collections of indicators that could apply to many businesses. But in many cases, even so, organizations using the indicators are still self-reporting their impact. And they know what donors want to hear, of course. Effort and expense. Remember that social sector franchise networks have their hands full solving tricky problems of distribution, supply chain, customers that don't have sufficient purchasing power, gaps in local infrastructure, and so on. This is an all-encompassing, immersive endeavor to try to address a serious problem in local communities and so on. And right in the middle of that, they end up paying for M&E officers, grant writers, photographers, technology to collect data, and so on. Sometimes these efforts and expenses are in line with tracking their impact and making impact, but often they're a distraction. Next, you have what I call method versus reality here. You can have a mismatch of method and reality. For example, the idea of a randomized control trial, wonderful idea. I remember some proponents of such trials advocating to me that I randomize where we would put new medical clinics across a broad landscape of 100 different villages that they would pre-survey. I love the rigor of this, but it makes little sense in practice and it's very expensive and takes time. So there can be a mismatch of method to reality. And lastly, outputs versus impact. Does it make sense to claim broad societal impact for a network of tiny retail shops in markets of hundreds of shops with so many other variables without something as comprehensive as a long-term randomized control trial? Everyone wants impact instead of quote unquote just outputs, but this can be awfully hard and burdensome with existing methods. And so with that, I'd like to turn it back over to Fiona and to Ashley to give some insights into this.
Great. Thank you so much for giving us that overview, Greg, and your experience as both a thought leader, but also somebody who has been doing social sector franchising in the field is really helpful to get that view. And we'll come back to you in a little bit after we've heard from Ashley. But I want to turn over now to Ashley Speyer. As Bill mentioned at the beginning, Ashley is the LEANDATA Senior Associate with Acumen, based in Nairobi. I'm really thrilled that we could engage Acumen in some of this work we're doing in social sector franchising. I've been a long-time fan of the work of Acumen since I heard their founder, Jacqueline Novogratz, speak many years ago. And as most of you on the call probably know, but in case that you do not, Acumen is an organization that is really, I think, inventing bold new ways to tackle poverty at scale. They have an innovative investment model that allows them to invest in and help scale game-changing companies that are creating social impact. And the investments that they've done over the last decade or so have impacted over 100 million people's lives. So when we talk about scale, Acumen is the gold standard for thinking about how do we scale life-changing and life-enhancing products and services. Over the time that Acumen has been doing its work, though, they have also wrestled with this question of measuring impact. And Ashley is going to talk to us a little bit about Acumen's journey from the struggle about collecting, sometimes very expensive data, sometimes even meaningless data, and to the model they have evolved to that has been getting a lot of recognition recently, which is their model of LEANDATA. They're now collecting this data with 35,000 customers globally, so they have a really robust data set in addition to a very innovative and robust approach to collecting data. So I'm going to hand over to you, Ashley. Thanks for being with us today.
Yeah, thanks, Fiona. Appreciate that introduction. I was going to start off with kind of a background of what Acumen does, but you did a great job of explaining kind of who we are. So yeah, I mean, as Fiona mentioned, Acumen is an impact investor. We've invested over $100 million globally since we started, and we're investing in social enterprises around the world that are providing access to products and services to low-income consumers. And so as an impact investor, it's obviously important for us to measure not only the financial success of our investments, but also to measure the impact. And so when we started to think about, how do we measure the impact of our investments, what we noticed is that there was sort of talk of impact measurement in the space, but not many sort of concrete ways of how to go about this. So if you go to the third slide, the next slide, please, thanks. Just provided kind of an overview of the sector's sort of progress to date. And so I think this is a nice sort of segue from Greg's talk, because he kind of alluded to the different, frameworks that exist, such as IRIS and GIN and GEARS. And so I think that there's been a lot of, useful measurement infrastructure. And what I mean by that is, these frameworks and lists of what to measure. But largely there hasn't been as great of a focus on the how. And so what we noticed is that we would, give our companies these lists of IRIS metrics and all these indicators that we wanted to see from them as Acumen. And to be honest, what that resulted in is that we didn't actually have a great understanding of our company's impact, because a lot of times they didn't have that data on their customers. So we started thinking about, okay, how can we provide our companies, or how do we start to think about tools to really go beyond just kind of what typical impact investors can tell you. So as you'll see on the next slide here, what we've explained is, again, what Greg was talking about around outputs. So a typical sort of impact investor can say, maybe the number of farmers that a company has reached, number of students maybe attending new schools, but rarely do, I think, companies or impact investors kind of go beyond that and really get to, outcomes. So are these farmers better off? What really is the value proposition to these farmers? Who are these children attending these schools? So it's kind of these, thornier, more in-depth questions about impact, which ultimately, will help the space better understand, interventions that are having the most impact, and how can we direct capital to those interventions. And so what this kind of made us think about really is a matter of moving away from this top-down compliance. And what I mean by that is, what data maybe is important to the investor or the donor. So on the next slide, you can sort of see what that chain looks like. And so, I think sometimes when we're, focused on thousands or hundreds of different metrics or indicators, and then, dictating, what's important to the investors or to the donors, we often lose sight of, what data is actually meaningful to help companies better serve their customers. What data can actually drive both social and financial performance. And so we wanted to make that switch to bottom up, what we call customer accountability. On the next slide, you'll see we're talking about, what data will actually help the company better serve the customer. And often I will say that what we found is that there's this intersection between data that is interesting for impact investors and data that helps, the sector better understand impact, and then data that actually helps companies better understand their customers. And what we're talking about here is customer centricity. And there was a great series recently in the Harvard Business Review all on customer centricity. And how they define it is deeply understanding, the wants and needs of your customers so you can fulfill them better than anyone else. And when we talk about scale, I think the new sort of competitive advantage globally will be this notion of customer centricity, and the companies that are able to understand their customers in a way that goes beyond just basic measures. I think those are the companies that are going to be able to have the most financial and social impacts. So that brings me to LEANDATA. And what LEANDATA is it's kind of, it's been incubated within Acumen over the past couple of years. And what it is, it gets at the root of what I was talking about earlier, where you have so much around what to measure, but not enough around how to measure. And so LEANDATA is an approach to impact measurement and data collection that's actually designed specifically for social enterprises and investors. And so, sorry, if you go back, yeah. So it's designed specifically for kind of maybe, more resource constrained companies that, don't have the time to invest the time or the effort in, these more robust or rigorous forms of measurement, such as randomized control trials, which quite frankly don't make a lot of sense for, a company that is iterating, that's moving really fast, and actually has decisions to make on a day-to-day basis. And so LEANDATA really leverages a proliferation in mobile that we've seen across the world. And so we use low-cost technology and methods to gather high-quality data quickly and efficiently. And so to date, we've surveyed over 35,000 customers from within our portfolio and increasingly from outside of Acumen's portfolio. We've completed more than 80 projects, We've developed, technology partnerships with SMS and, different platforms. And we've developed this local in-house research team in the regions where we work. So we work in East Africa, West Africa, India, Pakistan, Latin America, and now the US. And so most of the surveys that we do are conducted through phone. And so that's actually researchers calling our company's customers. And so, how LeanData works on the next slide, I won't go into too much detail, but sort of our USP, our sort of value proposition is around, as I mentioned, using mobile technology, building kind of standardized survey tools. And what I mean by that is, asking the same questions repeatedly at different companies so that we can start to benchmark performance, and we can start to see how and where certain companies are outperforming others, both within sectors and across different sectors. So again, we focus on kind of quick project delivery, typically between 6 to 8 weeks from start to finish. And then most importantly, helping our companies, develop insights that they can actually make decisions from. And so as, we're kind of growing our network and community of clients that are, a part of LeanData, we, as I mentioned, have done projects within our portfolio, but increasingly we're offering LeanData as a service to external companies as well, external companies and investors. And I think if you go to the next slide, what LeanData gives us for the first time is insight across our portfolio. And so what you can see here is data that we have on poverty focus. So what this means is the percentage of low-income customers that our companies are reaching. And so you can see on the left that our agriculture average, that means 66% on average of our agriculture companies are reaching customers below $2.50 a day. And so this is data across more than 20 companies within our portfolio. And it allows us to start making decisions and to start comparing performance in a way that, without this depth of data, we wouldn't be able to do that. And so on the next slide, this is just kind of, examples of how not only does the data enable acumen as an investor to make better decisions, but our priority, as I mentioned earlier, is driving value for companies so that they can sort of better understand their customers, better understand the way that they approach impact measurement and data collection, and ultimately helping them be more accountable to their customers. And so just, I don't need to go into too much detail on this, but the last slide, I just wanted to give you guys a kind of more tangible example of, some of the data that we're collecting. So Solar Now is a company in Uganda, and they sell solar home systems and appliances on credit to customers throughout Uganda. And as you guys know, there's kind of been increasing competition in the solar home system space, actually throughout East Africa. And so Solar Now wanted to know kind of what was driving customer purchase decisions, what aspects of the products did customers value most, were customers satisfied, and they just wanted more insights on their customers. And so we did actually, in the course of maybe a year, 3 different surveys. So one was kind of a core insight survey, which is one of our LeanData special surveys, which has helps collect insights across net promoter score, general satisfaction, kind of changes in quality of life. So it's really just understanding a customer snapshot and starting to get data on social performance. And then we actually did a staff survey. So we surveyed Solar Now's sales agents. So they have a network of sales agents that are selling these systems across the country. And then we also did a more in-depth energy data collection project to to kind of go beyond the core insights and better understand the exact sort of outcomes that customers are experiencing from having access to solar. And so, I mean, I think as you see here on the quote to the right, you know, Willem says, this data was a real eye-opener. I was shocked by how honest the answers were. And so what they found was, you know, actually a high degree of customer satisfaction issues. And so, you know, often what we find is that actually the negative feedback is most helpful and can really help companies understand, you know, where they should focus their efforts. We found that, you know, sales staff were, you know, wanted to be, you know, their incentive structure need to be sort of realigned. So that was a decision that was made. And then lastly, the marketing that Solar Now focused on was sort of adjusted to really emphasize the value proposition and the benefits that customers talked about most. And so I think, yeah, that's the last slide there. But what I hope that kind of gave you an overview of is how, you know, at Acumen, we noticed sort of an issue in this space that, you know, measurement frameworks abound, but when it came to actual data, there weren't a lot of, you know, low cost, quick, and efficient options for actually getting that data, and then more importantly, for acting on that data. And so that was sort of the impetus behind developing LEANDATA as a tool that can be used within our portfolio, but then more broadly in the impact investing space. And so our vision is that, you know, more people will start to use LEANDATA to actually start collecting data themselves, and we'll have for the first time, you know, benchmarking data, and we'll be able to compare sort of social performance in hopefully a similar way that we can look at and start to compare financial performance. And so I think, you know, ultimately what that enables us to do is to make sure that we're investing in companies that are providing, you know, products and services that have the most impact, and that we're directing capital in a way that's more accountable to the end customer that we're trying to serve. So thank you. I'm happy to answer any other questions about LEANDATA and provide any more sort of detail on Acumen's impact framework and how we look at impact.
Great, Ashley, thanks so much. And you know, I'm really impressed by, you know, both the rigor of this approach, but also the cost effectiveness and the sort of the quick turnaround that, you know, that is possible through this approach as well. Ashley, I just wanted, if people want to read more about this, well, obviously your slides will be shared in the recording of the webinar, but you also have there's a great piece about this in the Stanford Social Innovation Review. Is that the best way that people could read more about your work if they're interested?
Yeah, for sure. So we do have, I'll share these slides. We have, an article that was written about a year ago in the Stanford Social Innovation Review. We have a LEANDATA Plus Acumen course. So if you go to the Plus Acumen website, you can look for the LEANDATA course. And then as well on Medium, we have various pieces that we've written, which I can actually share the links with you, Fiona, and we can distribute that after the webinar. And feel free to get in touch with me. I can actually just type my email here. And if you have any questions or ideas on sort of how LEANDATA can be applied to your organization or to your company, just let me know. I'd love to hear from you.
That would be great. Thank you so much, Ashley. So I'm going to turn back to Greg Starbird, but just by way of setting the context. As part of our social sector franchise initiative, we do a number of things I described at the beginning of the call. But one of the things that we're very excited about doing that we started last year is that we identify early stage social sector franchise organizations, and we invite them to apply to our accelerator program. So last year we worked with 3 organizations. That process began at our annual roundtable in October. We spent all of the second day, working in teams to help those organizations think about how to address their most pressing strategic challenges and how to continue to move their concepts forward. And then following the roundtable that's held here in Durham, we assign mentors to each organization, and those mentors work on an ongoing basis over the next 9 months with the social sector franchise organizations. This coming year, we will be working with 5. And so if anybody is on the phone that knows of a social sector franchise organization that is at an early stage and facing interesting strategic challenges, we would love to know about them. Or if you are from one of those organizations and want to apply, you can contact my colleague, Bill Maddox, who introduced this call. But thinking about that process, I mean, we really think as we work with social sector franchise organizations, we focus very much on their most pressing strategic challenges. In other words, what are the barriers and the issues that will prevent those organizations from going to scale and achieving the impact that is part of their mission? And so I'm going to turn back to Greg just to reflect a little bit based on your own experience, Greg, working in a social sector franchise organization, but also thinking about some of the organizations that are part of our incubator program here at UNA. How do you believe we could field earlier?
Yes, you were just cutting out there. Can you hear me?
Greg, I think you may need to unmute your microphone.
Yes, can you hear me now?
We can hear you now. Thanks so much.
Okay, so thank you, Fiona. And Ashley, that was wonderful to see you present that. So yeah, Fiona, I see Ashley and Acumen and the lean data idea pointing at the reality that it's possible, even for smaller franchise companies and emerging social sector franchisors, not just to measure impact for one or more legitimate onlookers, the top-down approach that Ashley referred to, but to interweave making and measuring impact into the actual operation in some clever way, soliciting information from beneficiaries or community members or customers in some clever way, figuring out how to embed asking questions into the day-to-day operation so that you learn more from customers, from staff, from franchisees, and so on. So a theme that sort of emerged for me as I was looking at this over the past week, which is a lot of this has to do with exploiting touch points to the advantage of the franchise operation and to further its impact. So you can go to the next slide. So franchise networks, as I've repeatedly portrayed here today, have all these real touch points with different categories of people. It's easy, positioned as a franchisor, to ask questions of customers, of franchisees, of employees, of people in communities. These are geographically dispersed communities. You have standard ways of collecting data. Most customers have mobile phones now, as do franchisees, and so on. So a social sector franchise network is pretty amazing as an information gathering, behavior observing organism, if you want to think of it that way. A franchise network has access to honest answers, both answers via surveys and answers in action, like do you come in and buy things from the store, by all these different parties. So I want to talk about this application of lean data by way of another example, which is that in 2012, I and some colleagues were very interested to know more about the incentives and barriers to people coming to our franchised medical clinics in Kenya. So we invented and deployed a low-cost method to collect insight into these questions that I think is very similar to the lean data idea. So you can go to the next slide, which is my last slide. So first, we administered asset surveys to hundreds of community members living near a few of our clinics. And this is things like, do you own a bicycle? What is the roof of your house made of? How many goats do you own? And so on, along with age and gender and how many people are in your family and so on. So we had this So anytime you come to our clinic, you will get a 70 shilling discount. Another was, every time you come to our clinic, we'll give you a gift worth 70 shillings. So in the sense, they're both the same, but worded differently. We could have added, every time you come to our clinic, we'll pay for your travel there, and that might have helped us to see something about the barrier faced by customers in terms of travel costs and so on. So once we had come up with these coupons with different wordings, we distributed coupons randomly across the populations that we had surveyed with the asset survey. So if you're a member of that community, you took a survey asking how many goats you have and other things about your assets, and a week or two later, your phone would buzz or ding with a coupon that we would distribute to you by text message, and it would be only one of the coupons. So some people would receive coupon A for a 70 shilling discount, others would receive coupon C for a free tube of toothpaste with any purchase, and so on. And of course, upon receiving these coupons, some people would ignore them, some people would find it very attractive and come to the clinic, others would wait. People would decide whether to come to the clinic or not. And when they came in, we knew who they were according to the asset survey. We knew if more of the lower income people in that community would respond to a free tube of toothpaste than to a discount. Or we knew if people would, we even had ways of finding out if people would invite their friends to, or family members to use their coupon. So this was quite an inexpensive, fast method, giving us tremendous power of insight into otherwise opaque environments. Now, it turned out in this case, people liked tangible items, free toothpaste with any purchase at a clinic, for example, more than just a discount, whether by shilling or percentage. And when we asked more about this and thought about this, it seemed to us that customers were correctly perceiving something about the way money is used in Kenya, the fact that prices are set flexibly. They wanted something whose value is bodily and real. You can clean your teeth a bunch of times with this tube of toothpaste, rather than the theoretical ability to save enough money to buy some toothpaste later. Such an insight into customers can not only reshape a social sector franchise network's approach to local marketing and promotions, but it can help to draw certain populations into the little shop more reliably, such as lower income patients or pregnant women or children under 5 or whatever. So this is a way of measuring and making impact at the same time. And my point here is that this sort of fast, inexpensive method depends entirely on the fact that social sector franchise networks are present in dozens of communities. There are these touch points with customers, with franchisees already living in those communities, with staff, and so on. And it's all about thinking of clever ways to ask questions via surveys or in other ways of people and get information that's useful. So I think that what I've described is maybe a cousin of Acumen's lean data idea, and I use it as an illustration of the power of social sector franchise networks to exploit touch points, to measure and enhance impact through its actual operation for a very low cost. This can apply to a network with just 3 or 4 units, retail units, or even 50 or 100 or 1,000. So that is my last comment about this slide.
Great. Thank you so much, Greg. I really appreciate that. Can you just, before I hand over to Bill, who is going to give us some of the questions from some of the people listening, can you just talk a little bit about when you put that process in place that you just described? Did you have people on staff that had expertise in that kind of research methodology, or did you use outside experts?
A couple very much outside experts in that case, and staff. It was me, our main operations staff in Kenya, 1 or 2 people, and then 2 development economists, and we worked on this for a while. It took the main sort of intellectual work behind it really was trying to be clever about exactly what questions would lead to answers that were usable in the way that we thought we wanted to use, and it took quite a while to think of how could we word those incentives. But I think these days, when I looked over Acumen's lean data, I forget what you call it, Ashley, the toolkit or the playbook, to me, I thought, wow, if only we had had this back then, or it just looked so familiar that it really would be a step-by-step process from what I could tell reading it, to come up with usable insights in your franchise network without a lot of outside expertise.
I'm really glad to hear you say that. I mean, I always feel compelled as a social scientist to, data is incredibly powerful, and I think the framework that Ashley's provided about, not just using this as information for donors and investors, but really to help drive the business and for use by the entrepreneur and the company to improve their customer engagement and to improve their impact is really important. But data is only powerful if that data has integrity. And so I think one of the things that often frustrates me is looking in and seeing entrepreneurial organizations develop questionnaires and other data gathering that doesn't have that integrity. So I'm really glad to hear that you worked with the right partners to make sure that approach was valid and that the data had strong integrity. I'm going to hand over to Bill. So thank you, Greg, for both the prior piece and this piece in response to Ashley's presentation. I'm going to hand over to Bill. I know we have some questions from people on the call. So Bill, are you there?
Sure, yes. So our first question came in quite a while ago from Gail Work. And Gail has asked, in developing financial models, are different forms of financing being surveyed? And if so, what are the learnings, i.e. new models for bottom of pyramid financing? And I think that's a general question that either Greg or Ashley or Fiona can answer.
I'll take a shot at that.
Thanks, Greg.
Just to say that I think, so my firm, Starboard Consulting, does a lot of financial modeling for social enterprise. And I say that just to say that I'm familiar with the frustration of trying to make financial models that make sense and allow actionable insight in designing and refining some kind of franchise operation. Part of the frustration is that there is very little source data and to provide any sort of confidence in estimates of things like, I'm going to go open 50 water kiosks, how much will people pay for water, how much will the rent be, how much will people want to be paid, and so on. So I think that part of the implication for financial models of lean data is that hopefully more and more granular insight will start flowing into sort of the general community as well as individual brands who have maybe proprietary data they collect. And with that, new insight into what people really spend money on and their values and relative how attractive a specific incentive is to come join a franchise network as a franchisee or purchase something from a franchised location. That data will help inform financial models. So that's one way that there would be implications of this on financial modeling.
Yeah, I agree, and I think at a bigger picture level, one of the topics that we are exploring through our work in the Social Sector Franchise Initiative are, social sector franchising isn't sort of a one size fits all. There's not just one flavor of social sector franchising. There are many different models. There are sort of fully subsidized models. There are models that are seeking market rate return investors, and so there's a very broad spectrum. One of the things that we are hoping to do this year is to better communicate and sort of document the diversity of models within the social sector franchise field, and then obviously the next step is to talk about then which financing models sort of are appropriate for those different kind of flavors, if you like, of social sector franchising. Ashley, is there anything you want to add to that question?
Yeah, I mean, I think that, what Greg was saying, I mean, hopefully, and, the vision for Lean Data is that, we will kind of have a repository of data from, thousands of social enterprises, or just companies, working in these markets. And we can start to benchmark and compare performance. And, just as you have, a balance sheet with financial information, you could have a similar type of structure for social data. And so I think that, starting to to apply that same level of rigor that we do with, financial measurement in the impact space is definitely something that, is in pretty close reach now that we have all this data. And so I think that, yeah, I mean, where we were a couple of years ago, where, you don't have this level of comparable data across multiple companies in different geographies, it was much harder then to even envision what that might look like.
Thank you. Bill, other questions from
Sure.
people on the phone?
Sure. Actually, this is a question specifically for you from James Koch, and he asked, could you provide a list of the measures in LEANDATA and a sample of the feedback format?
Yeah, I saw that. That's a good question. So, yeah, I mean, there's no one list of all the measures. I think there's kind of categories of metrics that we collect. So, for example, in the energy sector, there's, a very robust set of metrics and indicators that actually someone on our team now helped to develop. And so that's the GOGLA energy metrics. And so we just completed a project, or we're in the process of completing a project where we've collected those metrics across, our entire energy portfolio. And so they're metrics related to, savings from like reduction in kerosene usage, greenhouse gas emissions. So, I mean, there's a whole set of them, but that's just an example. We have more general metrics that we like to include in most of our surveys. So as I mentioned, we have the Net Promoter Score. So that's the question that's, on a scale from 0 to 10, how likely are you to, recommend company X to a friend? We have a question that we call the quality of life question, which we actually developed over the past couple of years. And it sounds so simple, but it did take us time to really test the question phrasing and make sure that the answers we were getting were in line with the question that we're asking. So that question is, has your quality of life changed as a result of, product X? And then we have a list of, very much improved, no change, got worse, got a lot worse. We asked the PPI question, so it's Progress Out of Poverty Index. And so that's just an example, or some examples of some of the kind of common standardized metrics that we ask. And then in terms of an example output, I don't have that readily available. But yeah, generally what we do is kind of provide a presentation with a summary of, the data, and we help companies interpret the data and help decide how they can, make decisions from it. So it's generally in kind of just a PowerPoint format.
Great, thank you, Ashley.
So it sounds like, Bill, I was just going to mention
Sure.
it sounds like that you have questions that are specific to different sectors, but then you also have some more global measures that apply to companies across sectors. Is that correct, Ashley?
Yeah, that's correct. And I think, Fiona, what you were mentioning earlier, we've taken, we spent the past 2 years really scrutinizing every question that we ask and making sure that it's well understood, that it's not a leading question, that it's, recognized and interpreted correctly across all of the geographies where we work. And so we have like a data bank basically of questions that, are tried and tested and that we know work well. And so, it's interesting because if, right now, if you were to go online, or if you were to look for kind of tried and tested surveys or question sets, you wouldn't really find them. And so that's something we also want to do is, provide access to our, tried and tested question sets that we've developed over the past couple of years.
So just to let folks know who are listening to the broadcast, we will go over slightly because we do have a couple more questions that I do want to ask because they're important questions. This is a comment and a question from Ulu Wasegan Daniel Falaju, who asks, linking the asset survey to giving incentives is quite strategic. This will generate more client drive to facilities, and this can be an impact driver. How is this activity funded?
Yes, thank you. In the case of the example I gave, the activity was funded very easily in the sense that we used existing staff, including myself at the time, and staff in Kenya to think about these things and motivate franchisees and others to get ready for the experiment. We also had outside experts I mentioned who were development economists. They had their own money that they were interested in. They were interested in the results from a research perspective, and so they thought of this as part of their sort of portfolio of research. And then we had some incremental costs, but they were very minimal. I mean, we paid community health workers to go do surveys, and that was, you know, maybe a couple $1,000s total. Distributing bulk text messages is not expensive. We only had a couple thousand people we were distributing them to, and then everything else was just collecting information on people coming to the clinics. There was some lost revenue there because there were coupons, but sort of we intentionally did not go out and get funding for it, get a grant for it, et cetera, because sort of like Ashley alluded, the idea was we needed to move on this. We needed to figure out how we could consider subsidizing customers or whatever, and what would bring them to the clinic, rather than trying to prove a point to an outside group, which can be legitimate, but was not our main point. And the last comment on that is just that I think it's important for things to be fun. I know that sounds weird, but to get buy-in from the various parties and the various touch points, an experiment needs to make sense, needs to not be offensive, needs to be, questions need to be intelligible and simple. And each party in the network needs to know what its part is in the experiment. And so I think there's a communications role, again, that I would suggest doing, not with outside money, but just with sort of a smoothly functioning organization here. And of course, in general, if people wanted to do this sort of work, it's possible, I'm sure, to get Acumen involved, or my firm, or others in the space where there is a role for outside help.
Okay, and I'm going to squeeze in one last question from Francis Sinha. This is specifically to Ashley. Do you envision social franchises collecting and analyzing lean data themselves, or will there continue to be an external supporting role?
Yeah, great. So I think that question is a good extension to what Greg was just talking about. So I think that's a great question, and something that's really top of mind for us on the Lean Data team right now. And so I think the answer is both. So I think that, you know, there's a certain level of data collection that, frankly, I think every company should be doing. So, you know, taking advantage of those customer touch points, thinking about, you know, a company's customer journey, and then figuring out what are really easy, light touch ways that we can, you know, systematically collect feedback. So as an example, you know, maybe after someone goes into a health clinic, they get an automatic text that asks them, you know, how satisfied they were with their experience at the clinic. And so that type of, you know, data that allows for really fast, continuous feedback loops, I think companies should absolutely be doing. But I think that when it comes to even developing those processes, or, you know, collecting more in-depth insights, if you have a certain research question, or if you know, are struggling with this particular challenge and you want, you know, really deep insights into that topic, I think that that's where lean data comes into play, and that's where sort of the role for us will be. But I think, you know, in the future, hopefully we have sort of a lean data platform, or, you know, people can kind of contribute to it, and it kind of democratizes access to some of these tools.
Great. Thank you so much, Ashley. And I want to thank both Greg and Ashley for really some excellent, insightful information. I want to remind people that the slides, if you want to refer to them, will be up with the recording of this presentation. I want to thank Fiona Wilson for a great moderation job, keeping us on track. And I want to remind people, as we said during the broadcast, that we will be going through the second round of the Social Sector Franchise Accelerator. So if you know a promising social franchise that you'd like to nominate for the process, please contact me, and visit our Living Case Studies page that you can see up on the screen there, where you can look at the blogs, read the blogs from Jibu and from Zoeto, and follow along on this interesting action research project that we're doing to learn more about and help to facilitate the growth of the social sector franchise field. I want to thank everybody for your attention, and I appreciate everyone showing up, and I wish you good morning, good afternoon, or good evening, wherever you are. Have a good day.
Thanks, guys.
Thanks, everyone.